what advice you'd give a woman living with HIV after menopause and beyond to improve their health and well-being?
Thank you, Dennis. I think there's a good background to that question because one thing that I think a lot of people don't realize is that the period after menopause is the period at which women become vulnerable to long-term chronic conditions. So heart disease, dementia, osteoporosis, all of those things, the risk of all of those things becomes higher after the menopause, and is particularly important for women living with HIV because they have higher rates of those things because of their HIV. So taking HRT, if you can, is really important, or if you want to, but exercise, doing the right kind of exercise to keep you strong, to keep your heart going, to make sure that you don't lose muscle. So doing resistance type exercise is really important, as well as cardio to make your heart beat fast. Eating properly, avoiding highly processed food, because highly processed food we know drives inflammation, and HIV is associated with a lot of inflammation. So trying to reduce the amount of inflammation that you're exposed to is important. Trying to get good sleep. And I know that this is difficult, and we know from lots of studies that people living with HIV don't sleep as well as people who are not living with HIV, but finding ways to optimize your sleep is so important, and looking after your mental health. I think those are the most important things that you can do. And they're important not just post-menopause, but I think throughout life. And if you get into the habit of doing those things, then after the menopause, it's easy to maintain them.